You know, the world of dangerous substances is always changing. Just when we think we have a handle on the risks, new threats pop up that completely change the game. So let's get into what you really need to know to stay aware.
I mean, for years, fentanyl has been the name we all associate with extreme danger, right? But what if I told you there's something even more potent out there? Well, the answer, and it's a scary one, is yes.
So yeah, we're moving beyond fentanyl here. We are now facing a totally new wave of synthetic drugs that are just more powerful and way less predictable than anything we've really seen before.
Okay, to really get a grip on this, we need a baseline. And that baseline is fentanyl. We all know how incredibly dangerous it is. I mean, being 50 times stronger than heroin, that's a staggering level of potency that's had just devastating consequences. This is the threat we already know.
And here it is, the answer to that question we started with, nitazines. This is a class of synthetic opioids that's basically been emerging from the shadows. And believe me, they are completely rewriting the book on potency and risk.
All right, so now we have to put these two head to head, fentanyl versus nitazines. Understanding the difference here is absolutely crucial to grasping the sheer scale of this new danger.
Okay, so on one side, you've got fentanyl. Super potent, yeah, but it was at least originally developed for medical reasons. But nitazines, that's a whole different story. These are research chemicals that were never, ever intended for people. And that fact alone makes them wildly unpredictable and so much more dangerous.
Okay, just look at this chart. It really puts it all into perspective. If you think of heroin as our starting point, fentanyl is a huge jump at 50 times stronger. But some nitazines, they can be up to 500 times stronger. That leap is it's almost mind-boggling. It makes the risk of a fatal overdose astronomically higher. And listen, this isn't just some lab experiment or a what-if scenario. We're already seeing thousands of overdose deaths being directly linked to these new synthetic compounds. The data is screaming at us that this threat is very, very real, and it's here now.
And this is where things get even scarier, because we're not just talking about powders anymore. These incredibly potent substances are being disguised as medications you'd think were safe.
The way they do it is so simple, it's terrifying. Criminals can press a pill that looks exactly like the real deal. Same shape, same color, same markings. But inside, it's just filler material, laced with a deadly dose of fentanyl or a nitazine. There's just no way to know. You can't see it, you can't smell it, you can't taste it.
So what's the takeaway here? How do you actually protect yourself? The only way to be sure is to never, ever take a pill that wasn't prescribed to you by your doctor and filled at a real licensed pharmacy. Any pill you get from a friend, online, or on the street could be a deadly fake. It's that simple.
Okay, so we've talked about opioids hidden in pills, but that's not the whole story. The danger is spreading, and now we're seeing some really alarming trends with stimulants too.
You know, cocaine use is actually on the rise again. But here's the terrifying twist. It's often contaminated with fentanyl. That means someone who thinks they're just using a stimulant could accidentally have a fatal opioid overdose. They would have no idea.
And at the very same time, methamphetamines are still a massive problem. The potency is incredibly high, and the effects are neurotoxic, meaning it literally damages the brain, causing severe long-term harm, both physically and mentally. There's a quote that really hits the nail on the head here. The stimulant crisis is often overshadowed, but the dangers, including severe withdrawal, are immense. And this is so important to remember. Things like cocaine withdrawal can be incredibly severe and require serious medical help.
Okay, so we've laid out all these dangers, which is a lot. But just knowing the threat isn't enough. We have to talk about the path to recovery. And for so many people, that journey is deeply tied to mental health, where some really innovative ideas are making a huge difference.
And something that's absolutely critical to understand on this journey is what's known as co-occurring disorders. All this means is that a person is struggling with both a substance use issue and a mental health condition, like depression or anxiety, at the same time. The two are almost always connected, and you have to treat them together to get to a lasting recovery. So when you're dealing with something this complex, you need more than just one tool in the toolbox. And one really interesting and powerful approach that's gaining ground is music therapy. It's a creative way to give someone critical support for their mental health while they're on that road to recovery.
So how does that even work? Well, it can help lower stress and anxiety, it can boost a person's mood, and it gives them a healthy, nonverbal way to work through really difficult feelings and experiences. It's really about healing the whole person, not just treating one symptom.
So where does all this leave us? We've seen these new, incredibly powerful drugs like nitazines. We've seen how they can be hidden in plain sight as counterfeit pills, and how the stimulant crisis is creating its own set of dangers. The big question, the one that affects all of us, is, with these threats changing all the time, how do we protect ourselves and our communities?